Now we have rising cases of the easy-to-transmit Delta variant of the virus in the country. On account of this, once again, and for the third time since we started the briefings, the Honorable Minister of Health, Dr. Osagie Ehanire, is here with his team to brief us on why Nigerians should not worry, but should be concerned about the situation. Of course, the Honorable Minister will also intimate us with arrangements in place for the rollout of the second phase of the vaccination exercise occasioned by the recent receipt of the 4 million plus doses of the Moderna COVID-19 vaccine from the government of the United States of America. As I said earlier, the Honorable Minister is there with the team from NAFDAC, the DG of NAFDAC is there, and the DG of National Primary Care Development Agency is there. On this note, let me invite the Honorable Minister to brief us, and afterwards, take some of our questions. Honorable Minister, sir.
Good morning, everybody. Biodun, thank you for that introduction. We have been told that the purpose of this briefing is for the Ministry of Health to be able to present the true state of affairs to the country so that we can counter the impact of fake news, rumors, and stories that are conjured up around the COVID-19 vaccines and testings. So I welcome you all to this briefing. I'm accompanied today by the Director General of the NAFDAC, National Agency for Food and Drug Administration and Control, Professor Adeyeye. I'm also accompanied by the Executive Director of National Primary Healthcare Development Agency, Dr. Faisal Shuaib, who is responsible for administration of vaccines in Nigeria. And joining us soon will also be the Director General of Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekwazu. Now, I will just give you a brief background and overview of the situation. The Nigerian government responds to the COVID-19 pandemic, which was first reported, as we all know, on the 27th of February 2020. And our response you can put into 4 major categories. First is surveillance, which will include prevention of importation, case finding by testing for COVID-19 disease, and all in an attempt to prevent transmission within the country. The second is the treatment of confirmed cases and the observance of infection prevention and control measures. Third is how we administer vaccines to eligible population, and included in that will be the measures around confirming the kind of vaccines that we are using. And finally, very important, that in spite of all the anxiety about COVID-19, that we sustain other health services, that other health services in the country are not abandoned or left to fall between the cracks. Now, since the month of August this year, we began to see a rise in our COVID-19 cases, and that is when we officially declared that we are seeing the so-called third wave, the surge, which has been generally attributed to the Delta variant of the virus. With a background overview of the pandemic in Nigeria, as of 11th of August 2021, the government of Nigeria has confirmed just the following statistics, which by now maybe have changed a little bit, but I gave you the date that this comes from, that the total number of confirmed cases is 179,118. Active cases are 10,783. The number of discharged cases, 166,144. And sadly, the number of fatalities is 2,194. Further details will be provided by the operational leads when they begin to make their own presentation. So we have declared that Nigeria is officially in the third wave of the COVID-19 pandemic. And as you know, it has already spread in many parts of the world, mostly in India, where it was first recognized, spread into Indonesia, Thailand, Burma, Bangladesh, and also many parts of Africa, including West Africa, where the spread has gone on from Senegal through Ghana all around us. There has been in all these areas a marked increase in the number of Delta variant confirmed, and that is what necessitates this brief to Nigerians on plans that the government is putting in place to manage these rising cases recorded in the country and to mitigate the spread of this variant in our country. Following the recent COVID-19 vaccination of some Nigerians with AstraZeneca vaccine and the recent receipt of about 4 million doses, 4,080,000 to be precise, of the Moderna 19 vaccine from the United States government, and we thank them for that. There is an addition of other vaccines being expected, both from the Africa Vaccine Acquisition Task Team, AVAT, and also from bilateral agreements that we make with other countries who send us their vaccines either through COVAX or in some cases directly, like the government of India that sent us 100,000 doses of the AstraZeneca. If we work together, and this is not only government, it's also got to do with citizens, agencies, and not the least, the media, we do have a good chance of scaling through this COVID-19 third wave threat. And I want to thank all Nigerians in front for the support and participation so far, which has made this battle, well, let us say, controllable. And the successful implementation of non-pharmaceutical interventions and public health measures since we started this vaccination and since this epidemic came in remains very, very important. Therefore, everyone has a role to play: the government, citizens, media, partners, NGOs, CBOs and CSOs, traditional rulers, political leaders, community leaders, all have a role to play in here. This is a collective effort. It's a national effort. What is surveillance update? Now, cases have started to rise gradually since several weeks, and also there have been weekly increase in fatalities recorded in the past 4 weeks or so. Currently, the states that have the highest contribution to the national caseload of COVID-19 are Lagos, Akwa Ibom, Rivers, Oyo, Ogun, Ekiti, and the FCT. These are the ones we have called the red alert states. And we call them that because they require extra attention to contain the COVID-19 outbreak in those places. The World Health Organization did classify the variants and call them the Alpha, Beta, Gamma, Delta, and of late, the Lambda variant. And these are variants of concern. Now, the country is particularly concerned about the Delta variant because it is much more transmissible. It has been estimated to be 60% more transmissible, which means that where one virus of the previous variants will infect 100 people, this particular one will infect 160 people. That's a lot. Secondly, this variant is also of concern because it affects even younger people. Before now, we did see that younger people would largely get away unscathed from the infection, and we expect the vaccination from 18 years upwards. But this Delta variant attacks people, and remember we also did say that those who suffered most from the COVID-19 were those who had underlying ailments. But this variant seems to care less. It does not discriminate too much whether you have underlying ailment or not. And we have seen cases, even this morning, I saw on TV a 14-year-old who had been in coma and was just recovering from this disease. So those are the reasons why the concern about COVID Delta variant is very, very high. So the non-pharmaceutical interventions, that is to say the public health measures, are still extremely important because that is the main weapon we still have, and it works. It is something that we can rely on: wearing of masks, using sanitizers, social distancing, avoiding crowds, and also generally observing hygiene if you have a cough or a cold, and reporting when you do not feel well. You might hear me repeating this over and over again because it's critical. Now, until we have received and vaccinated enough people, and our target 70% of our eligible population, we cannot begin to think of relaxing. Even countries who have done much higher vaccination, the US has, for example, vaccinated 61% of population fully, and the UK even higher. But they are still seeing a lot more cases, and they are panicking, just as we are, about the impact of the Delta variant in their countries. But one thing that is clear, and I can say that up front also, is that for those who are vaccinated fully and they get infected with the variant, the Delta variant, have a much better chance of recovery. A less percentage of them will get into hospital or into ICU, and fewer fatalities, so that the vaccination does help. That is why all countries are prioritizing this vaccination, and we are doing that too. Now, what do we do about the points of entry? Now, points of entry are the pathways by which persons coming from outside enter our country: by air, there are 5 airports, and by land and by sea. Now, the competent public health authority is the Port Health Service of Nigeria, currently manning about five international airports, 9 seaports, and several land borders. COVID-19 came in by importation, by people who traveled into the country. Therefore, as we try to take control of the transmission in country, we also do not lose sight of the fact that even more can still be coming in. That is why this particular topic is very, very important. Following the confirmation of this third wave, Port Health Services has heightened surveillance at all points of entry, screening all passengers coming into the country from major points of entry. There are persons of interest from red countries. The red countries, again, those countries where there is particularly high occurrence and prevalence of this Delta variant. At the moment, they are India, Brazil, Turkey, and South Africa. And once they are identified as coming from these areas, they are taken into government-approved quarantine facilities and observed for a period of time. And where possible, samples are taken for sequencing to confirm whether the virus they came with, if they are positive, is of the Delta variant or any other variant. Now, we also do verification of the PCR results to detect fake results. There are some people who come into the country with fake PCR results because before you come into Nigeria, you are supposed to have done a PCR test within 72 hours prior to that. Sadly, we do see fake results coming in, but they will be detected here because there are control measures in place to do that. Violators and defaulters are immediately taken to quarantine facilities and handed over to security agencies for prosecution. The Port Health Service has also now commenced testing at land borders, doing rapid diagnostic tests, which we have instigated and are going to expand. They're presently going on in Seme and Idiroko. We are going to expand them in other areas. And within the first week when we started border control testing, we discovered 6 positive cases at the land border. One of them, who is not a citizen of our country, was returned, not allowed to enter. And the others were sent for further investigation and the measures that we take. Now, what's the situation with vaccine? The federal government, through the National Primary Healthcare Development Agency and NAFDAC, has taken several actions with regard to vaccines. The target, as I said earlier, is to vaccinate 70% of Nigerians to get what we call herd immunity. That herd immunity means that the likelihood of transmission from one person to the other is grossly reduced. But to achieve that 70%, most Nigerians have to submit themselves to vaccination. And I can say here, you hear me say it again, that this vaccine is safe. They have been tested. They have been taken by many persons, His Excellency the President, the Vice President, Senate President, many traditional rulers, religious leaders. They have all taken this vaccine. So this vaccine hesitancy is uncalled for. This morning, again, I saw on TV a family that had been totally against vaccination. And they had said they would not take until their 14-year-old daughter came down so sick with COVID-19, had to be taken to intensive care, 14-year-old, mind you. Intensive care, I was just lucky to survive. And then that's when the family realized that this thing is real, and they all went to go and take the vaccination and urged their neighbors to take the vaccination. Now, we have received 4 million doses, 4,024,000 doses of AstraZeneca COVID-19 vaccine, with which we vaccinated just over 2 million citizens. And most of them, about 1.2 million, got complete doses, and about 600 or 700 got only partial doses, but we are expecting more to come so that they can get their second doses. Now, the vaccine exercise has been, for that particular tranche, has been successfully implemented in all states, and because the vaccine ran out, it ended around the 8th of July. We don't have any more vaccines. Now, getting vaccines at this time is extremely difficult because Nigeria does not produce any. In fact, Africa does not produce any except South Africa that manufactures Johnson & Johnson under license from a US company. So therefore, many countries producing vaccines have been reserving these vaccines for themselves. And a huge advocacy has gone on from the World Health Organization and many other organizations calling for equity in vaccine distribution. So we have just now begun to receive vaccines with the Moderna vaccine that just arrived, and we are expecting very soon doses of Johnson & Johnson, Pfizer, AstraZeneca in our country. So in addition to the 4,080,000 doses of Moderna vaccine from the United States government, which came through the COVAX facility, Nigeria has paid for 29,850 doses of Johnson & Johnson vaccine, walking through the African Union facility that I spoke of earlier, the AVAT facility. This Johnson & Johnson vaccine is particularly useful because it's a single-shot vaccine, and it's useful, very useful for mobile populations. Those are itinerant workers who move from town to town. It is very useful for people who live in hard-to-reach areas, maybe villages in difficult places up on top of hills, inside the creeks, or in very lonely, deserted areas, places where it is difficult to get to. So you only need to go there once and give them the shot and save yourself a second journey in there. It's also good for nomadic populations who move from place to place, and you might not get a chance of getting them a second time. So we're expecting again another batch of 176,000 doses before the end of the week to begin that particular series of vaccines. The NPHCDA will give more information about that, but we also have information that Nigeria will have another 3.9 billion doses of AstraZeneca and about 3.577 doses of Pfizer through the COVAX facility within this month or at the beginning of next month. So we shall begin to have not only many vaccines, but also a variety of vaccines. And I can add here that 6 vaccines have been approved by NAFDAC. Without that approval, we do not use the vaccine. And the approval is very strict and also very well controlled. Now, the phase 2 of vaccination in all states plus FCT is scheduled to begin after, that's at the beginning of this month, that's from the 16th onward, while immediately the due diligence of NAFDAC has been carried out, and the vaccines are released for engagement. Remember that the Moderna we're using for the first time. Up to now, we have used AstraZeneca, and because the new vaccine, it's working in all the countries where it has been used. NAFDAC is doing all the due diligence to keep Nigeria away from any harm. And I also want to mention here at this point that because vaccines have become big business, there are many fake vaccines going around. There are people who are very busy manufacturing fake vaccines. There have been reports of whole provinces, not in Nigeria, whole provinces in other countries where they carried out vaccines in the whole province only to discover that what they were injecting was water. And criminals are also going around trying to sell vaccines to several unsuspecting countries. That's why Nigeria makes its own purchase, not from private sources. We get from the African Vaccine Acquisition Task Team, we get from COVAX, and we get from bilateral, which means from another government. And after getting those vaccines, we also do very stringent due diligence here by NAFDAC, and they are properly stored, properly administered through NAFDAC and NPHCDA, so that Nigerians are protected. And we also do a lot of follow-up after vaccine to make sure that Nigerians are okay. Now, sensitization of Nigerians on the need to receive available vaccines is currently ongoing all over the country, and those who do not understand the urgency for vaccines need to be made to understand, and that is where the media play a very important role here. There are a lot of mischief makers in social media who try to tell the opposite stories and give all sorts of contrary evidence that create confusion in the minds of people. And it's not only in Nigeria, it's many places in the world that this is going on. If you look at certain clips that are going around, false stories, disinformation and misinformation is going on. We need to counter that and encourage our people not to fear these vaccines. It's helpful and useful for all of us. Now, the challenges we have observed during the first phase of the vaccination included hesitancy, the global shortage of vaccines for vaccinating of eligible population, the recent detection of the Delta variant, which has given everybody cause for concern, The president, in his wisdom, set up the Presidential Steering Committee, and before that was the Presidential Task Force, which has done a fantastic job in bringing all the ministries that are concerned with response together to examine the whole panorama of responding to this infection, and has done a very great job in looking after the needs of our country. Now, it is this the Presidential Steering Committee that has categorized states into red states, both inside the country and also those outside the country. Again, let me say that the vaccines are safe, they're effective. We are giving them to everyone who is 18 years and above, according to a fixed set that prioritizes health workers and those who have underlying ailments, and those who are above the age of 60, 50 or 60, and or have some immune compromise. So if you are eligible, you can go to a nearby health facility to receive your own vaccination. Now, case management. How do we manage the cases of people who are infected? As I said, many people will be infected and will have no symptoms, and you will not know. There are others who are infected and they have mild symptoms, and then they will think it's just maybe cold or malaria, and they might be all right. But there are a few people who become very, very sick, and those are the ones who need to go into hospital. And the case management pillar plays a significant role in containment of COVID-19 pandemic by ensuring isolation and admission of symptomatic confirmed cases and coordinating the management of these cases to achieve good outcomes. We have about 125 functional isolation and treatment centers as I speak, and only 8% of them are occupied right now, which means that there's plenty of room if we do suffer a huge deluge of infections with serious symptoms. We give continuous supportive supervision to these centers. Many of them are run by the state, but a lot of them are also run in every of our teaching hospital and FMC, and we enhance informed decisions for appropriate intervention. All federal tertiary hospitals have been supported to have an isolation center, a 10-bedded ICU, and a molecular laboratory, so that they can be able to take care of critical, severe cases. Very, very mild cases are taken care of in their homes, in what we call home-based management. And the money for carrying out all of this has been released by the government. Now, working with the WHO, we have carried out assessment of our oxygen readiness at 125 isolation and treatment centers, and we have identified the gaps that require attention. And in view of that, the federal government established 38 high-capacity oxygen plants in Nigeria. And in addition, we received support from the Global Fund, which normally supports us in treating AIDS, tuberculosis, and malaria. They decided to also support us in treating the COVID-19 pandemic. And in addition, they are supporting us with 12 additional oxygen plants. They're helping us to repair all oxygen plants that we had before, which were not functional, which had issues with repairing them. There are almost 30. And we are also going to have 12 oxygen tanks, liquid oxygen tanks, as backup in major areas where COVID-19 is treated. They will all be strategically located so that no facility needs to go too far before they find oxygen. How are we preparing for this new wave? Well, we are reactivating our emergency operation centers, especially beginning with the high-burden states which I've mentioned, and reactivating all treatment centers, both old and new, across the country. And we have been supplying ICU equipment, consumables, and PPEs to all our centers. And we're while we are waging this relentless war to combat the spread of COVID-19, it is important to add that other diseases of public health interest are also around the corner. Recently, we have been dealing with cholera, which has ravaged the country. We are responding, working with the Ministry of Environment, Ministry of Water Resources, and so on. But that's not the subject of now, but just to tell you that we are not leaving anything out of sight, okay? And I would like to again assure all of you that government is on top of this situation. The Ministry of Health and relevant agencies are deploying all necessary machinery and strategies needed to contain the spread and the impact of this disease. We have also been training intensive care specialists. The last batch was South-South and Southeast, those who are going to man ventilators and oxygen therapy and be receiving training. Recently, the USAID offered us again some more training. We are very grateful for this vaccination, for this help that they are giving to us. Now, I want to urge all Nigerians to first of all observe the non-pharmaceutical interventions and what we call the public health measures. For infection prevention and control, they are extremely necessary and the most important that we have, the most important and the cheapest and easiest tool that we have. Your mask, social distancing, avoiding crowds, particularly in this very dangerous period. Crowds you will find if you are going to places of worship, market, clubs, parties. All those can be high risk at this time of the pandemic. Finally, I want to ask that you help us to brief your readers and listeners in all the points that we have brought forward now, and to free to ask questions or come to the Ministry of Health. We have a department of, we have a media department there that can provide answers. You can also speak to any of the two ministers and get all the information you want so that you do not allow fake news to take control of the space. I will now ask the Director General of NCDC to present a brief from his own point of view, followed by the Director General of NAFDAC, and then the Executive Director of NPHCDA. After that, we shall take questions. Thank you.
Honorable Minister of Health, DG, ED, colleagues, gentlemen of the press, I think you'll agree my Honorable Minister has really given an exhaustive account of development, so I'll keep my comments very, very brief. Yes, we are in the third wave, but we are not where we were in the first or second. We know more, we have more tools, and we're more determined than ever before. Yesterday, we recorded the highest number of single cases in a day in the third wave. We had higher numbers on the day in the second wave, but really, day to day, week to week, over the last few weeks, our cases are increasing. While bed occupancy is fairly low nationally, in Lagos it's up to 35%. And in some hospitals in Lagos, providing care is up to 70%. So these cases are not equally distributed across the country. So averages hide details. So we need to look into our data. The SITREP is put on the website every single week. So I invite all of you to look at it and look at it in detail. So you can then ask states specifically what is happening in their states, because our responsibility at the national level is to provide national figures, but below that, you can see different levels of the epidemic in different states, which is very important. Nationally, the single most important indicator that we monitor is what we call the test positivity ratio. So the number of positives out of all those tested. And in the last 2 weeks, this has risen to 8%. So 8 out of 100 tests are now positive. So very clearly, we are seeing an increase in cases across the country, and we have to respond. What is driving this increase? There are always 3 ways to think about it. The virus, what we are doing as individuals, and then the public health response. In terms of individuals, it's not news to any of us that many of us have dropped those critical measures that we need to carry out. We see events happening all over the country. We see very few people wearing masks. The consequences will be obvious, unfortunately, unless we go back to some of these restrictions. Secondly is the virus. 80% of all recently sequenced viruses are the Delta variant. 80%. So this is a much more transmissible virus. 80% of all those that we have sequenced with all our sequencing partners in Nigeria in the last 4 weeks are the Delta variant. So this is what is driving infections. Now, what tools do we have? And this is really at the heart of my comments today. What tools do we have for prevention? What tools do we have for detection? And what tools do we have for the response? In terms of prevention, our tools, the most important new tool we have is vaccination. And my brother, the ED, will, and the DG of NAFDAC will say a lot about this particular area, what we can do, what government is doing, what individuals need to do. In terms of what we can do, again, to prevent, everyone in this room is wearing a mask. We need to consistently do this in every setup, wherever we are. It's not comfortable, but this is a price we have to pay. The alternative is much, much worse. So we have to continue doing what we can do in prevention and ask ourselves, what tools do we have? Secondly, what tools do we have in detection? We are definitely not where we were earlier. We have our warehouses are full of laboratory tests. We're supporting the states to use this. We're thinking of different methods to increase access through whatever program is already existing in the states. So by detecting more, we're able to respond, and the states have done an incredibly good job. Most states in scaling up not just the lab capacity, which is something we talk about all the time, but sustaining the people that are collecting these samples, and I really want to give credit to public health workers at the state level to do this. The second bit is our sequencing capacity. That tells us what type of virus, what variant, and what characteristics they have. And definitely our partners at the Africa Center for Excellence in Genomics, the Nigeria Institute for Medical Research, and ourselves really working together at the National Reference Lab to make sure we're able to define the variants causing transmission in Nigeria. And thirdly is our ability to respond. What tools do we have? The Honorable Minister has defined the extensive investments now being made in rolling out our oxygen infrastructure in the states, and federal institutions will be very critical. We're supporting every treatment facility with all the infection prevention and control commodities that they need. So in terms of preparing for this third wave, we are preparing, but the issue is that the system is what it is. So we know the fragility of our health care systems across board, the challenges that we have in managing it, the various needs in federal and state institutions. So we don't want to stress the system to find out whether it will survive or not. So the best tool we really have is really to focus on prevention so that our systems are not overwhelmed. So I'll pause on COVID there and really be open to any questions you might have on any aspect of the outbreak. Say 2 final words. One on cholera, like the Honorable Minister has said. We must remind ourselves that as much as we focus on COVID, Cholera is a disaster in Nigeria right now. We've lost more people from cholera this year than from COVID. It's unfortunate that the others of society that don't get a lot of attention. We have been appealing to everyone concerned, our state governments, our healthcare workers, communities, to do what they need to do. In the short term, we're already in an outbreak, so there are certain things that we can't do now. But what we can do now is to insist on boiling our water as much as we can, do massive chlorination, buy local chlorine, and chlorinate the water we're using and use it to disinfect our tools, our utensils, and to try to prevent transmission at the moment. If you see anyone in your community practicing open defecation for whatever reason, look for some ways to manage that situation with whatever local tools you have. But in the longer term, all of us have a responsibility to really push for increased investments in wash infrastructure. What do I mean by wash infrastructure? Both among the rich and the poor, we are in trouble. We used to have water reticulation systems in our cities. Now, every middle-class household in Nigeria relies on a borehole. Boreholes have intrinsic challenges. The poor rely on water fetched from downstream when someone is defecating upstream into the same stream. So we need to educate our people. We need to encourage our state governments to invest in water distribution and really raise this with your support up the agenda in the press, in the media, among our politicians as we go into the next election cycle in Nigeria. So really, cholera is a massive problem. We have outbreaks in 22 of the 36 plus 1 states in Nigeria have ongoing outbreaks right now. And we need to save those lives as much as we need to save the lives of people with COVID. And finally, you would have heard the announcement of a case of Marburg virus in Guinea. Marburg is a sister brother virus to the Ebola virus with all the potentials to cause spread and panic. Yesterday, we carried out a risk assessment at the Nigeria Center for Disease Control. We have an Ebola working group that's constantly on the alert, so we're putting together a plan. Right now, I can assure Nigerians we have the reagents to detect cases should they occur. Of course, our Port Health Services team has been on the alert since early this year and will continue to do that. But really to assure everyone that we're on top of this, we'll do what we need to do to be able to detect if we have a case and to respond if necessary. But for now, we continue to respond to the outbreaks we're dealing with day to day. So thank you very much. I look forward to your questions.
Good morning, Honorable Minister, fellow DGs, heads of agencies, and Mr. Additional, and of course our most important people in the house, the media. Media is extremely important in anything we do as a regulatory agency. In terms of the COVID pandemic and NAFDAC, I'm going to talk on 6 areas. First is the preparedness that NAFDAC has had. And then the review of the doses or the package for each vaccine as they come. And then approval of the doses. Then thirdly, the stringent review of the approved vaccines. Meaning we review the doses, then when the vaccines come, we use stringent measures to ensure that what we read, what we assess, is what is coming to the country. Fourthly, once the vaccines arrive through our ports, Inspection Directorate, then we start, or we set up what is called traceability, and I will expand on that. Once primary health starts the distribution and delivery of the vaccines, we partner with them, and we start doing safety monitoring. That is the fifth aspect of what I'm going to talk about. And the sixth aspect is continuous information sharing and sensitization about COVID, non-pharmaceutical means to prevent it, and of course, the safety monitoring, sensitization about it. I will be talking about all this. NAFDAC started this journey around April of 2020 in terms of preparedness, having tens and tens of meetings, workshops with different agencies across the world to prepare us, first to make us understand what is COVID-19 disease, and then the vaccines that will be coming in later. Meetings with WHO, with International Coalition of Medicine Regulatory Authorities, with African Union Smart Safety Surveillance, training of our staff. We launched Med Safety app October last year. It is a device, mobile device that can be used to record any side effect from any drug. But it came in on time, or it was timely when it arrived, that we started using it for COVID-19 vaccine in terms of side effects that a patient or a vaccinee may experience. Then we started training across the country. Our staff, we partnered, collaborated with MPHCDA, started training the disease specialists across the country how to use Med Safety app. Why is it so important? It is important to record any side effects, whether serious or non-serious, because what we were going to give is emergency use authorization. It is not full approval. Any drug that is given emergency use authorization has to be followed up carefully, to be monitored in what we call the phase 4. When a product is being developed, it goes through preclinical studies, and then when it goes through clinical studies, phases 1, 2, 3. What differentiates between phases 1, 2, 3 is the number of subjects or volunteers that are used. After passing phases 1, 2, 3, phase 4 is when it is now being used by a larger population. And in this case, all the vaccines have gone through phases 1, 2, 3. And when they now come to our country, we get into phase 4, although it's still emergency use or authorization, but we have to be very vigilant. And we trained ourselves, or we were trained, or trained others on how to be vigilant once the vaccines come in. Our first vaccine was the Covishield, or AstraZeneca from India. And we were, thank God, we were well prepared for that. And because we dealt with the manufacturer, personally, I dealt with the manufacturer in India to get the information that we needed. We were able to track and trace every vaccine, AstraZeneca vaccine, the 4 million that came into the country. And I will be talking about that. So this training stage was extremely important for preparedness. NAFDAC was the first regulatory authority in Africa to write the preparedness guidance. It's on our website. Then, after the Covishield, we were able to get the dossier directly from them. But then there's a mechanism through which you have to go through WHO to get the dossier. We started receiving the dossier. Of course, we approved Covishield February 18 of this year, and then we started receiving other dossiers. The dossier is everything to do, has everything to do with the development. From when it's being tested in the petri dish, various or using cell lines, to animals, to humans. Then those years when they come to us, we use stringent measures to review the dossier. The fact that other countries might have approved that are stringent doesn't mean we will take their word for it. We check, we spend about 15 days reviewing the dossiers, and it is multidisciplinary committee. NAFDAC is a scientific organization made up of pharmacists, scientists, biochemists, name them. So we come together, the vaccine committee come together to review each dossier. Thus far, I mentioned we have reviewed AstraZeneca India. We have reviewed and approved AstraZeneca India, AstraZeneca Korea, Pfizer, BioNTech, Johnson & Johnson, Moderna, Sputnik V, and now we are working on Sinopharm from China. I mentioned that we have to use stringent review of the approved vaccines. Once we approve them, that doesn't mean we're going to just take them when they come. They come with information. We take samples at the airport, cold room, and we analyze in our lab. Because we want to be sure that what we read in the dossier actually matches what we are testing in the lab. Why? Because the health of our own people is premium to us. Our mandate is to safeguard the health of our people. So once we then declare from the lab testing and desk review, other review that we do on paper, we approve. We approved Moderna vaccine a few days ago, but with the arrival of the Moderna vaccine, we found out that the barcoding that is needed for the traceability was not full barcoding compared to the Covishield that we got from India. India is a little bit more advanced in barcoding, labeling, and it has nothing to do with the quality. No, it is just ability to be able to track using barcoding how the vaccines move. So what we then had to do with Moderna vaccine is to add another label to the packaging. Again, it has nothing to do with the quality. We have approved it as a very good quality, safe, and efficacious product. As we speak, about 30 of our staff are working to affix this secondary labeling that will make us, like we did for Covishield, to track and trace every vaccine buyer or doses or whatever that will be administered in the country. For Covishield, Nigeria is the first country to use the track and trace GS1-driven technology to track COVID-19 vaccine. We are the only country that has done that. And we were at a meeting with Oxford University where AstraZeneca was made last week, Monday, and they now call what we are doing the Abuja principles. We are building on that because why? Our motto now is customer focused, agency driven, and country dedicated. We've got to project the image of this country positively, and NAFDAC works around the clock, especially with this COVID vaccine, COVID-19 pandemic. So, with Covishield, we were able to use that technology to track and trace across 34 states and FCT. Because it's new, we weren't able to catch, I think the internet connectivity in 2 states weren't good enough for us to follow up the monitoring. But now we are ready, and we're going to follow up the distribution of Moderna vaccine. Why is this so important? Because of falsification. Substandard falsified medicines are flying all over, and we want to be sure that what we got is what the patient is going to be given. So this track and trace is to prevent falsification or to monitor the vaccines to make sure there is no infiltration. So that is the fourth point, traceability. I mentioned that. And for Moderna, we're going to do that. What is very interesting in what we did is that we use what is called GLN, or Global Location Numbers, almost like what you use for GPS in your vehicle. So we were able to use, to have 440 locations in Nigeria that we allocated global location numbers to, so that if a vaccine is at location number 1, it is tracked. And it is different from the one that is location number 420 or whatever. So very good things are coming out of this pandemic as far as the regulatory system is concerned. Now that primary health is delivering the vaccine, we get into action in terms of pharmacovigilance. One of our core mandates is pharmacovigilance and post-marketing surveillance. We didn't do this alone. We collaborated with primary health, and we took this also continental to African Union Smart Safety Surveillance. And when I mentioned to them that we are working with primary health in order to ensure that the delivery of the vaccine will be optimum, the 4 countries that are in the steering committee, NAFDAC, or Nigeria, Ghana, Ethiopia, and South Africa, WHO told them, use Nigerian format, working with primary health to ensure effective delivery of the vaccines. So a lot of things going on for us as a country. But it is not just that. I want to bring in what the government has done. Because of the neglect of the health sector for decades, the government realized that they have to capacitate the sector, and NAFDAC is one of them. So the government gave some money to redo our vaccine lab. We are doing that as we speak. It was approved about 2-3 weeks ago by FEC rather. So it is not just now, it is what will be sustainable, or what we're going to be sustaining in the future. So coming back to safety monitoring, I mentioned that we have trained people across the country. We have 2 pharmacovigilance officers per state, working with primary health and using Med Safety Hub to catch any side effects. We've been very successful. We have over 12,000 reports of different side effects, and we now have to collect all this and put in a database called VGBase, which is operated by WHO. So why is this so important? I mentioned that there's a continuous sharing of information by all regulatory agencies across the world. We meet every other week. So that whatever package insert came with the vaccine, or the leaflet insert, that the thing that you pull out and start reading, may be modified. For example, AstraZeneca package insert has been modified because of the report that we regulators make globally. So that if there is headache that was observed that was not there before, then they put headache, just to protect the public. And finally, sensitization. Extremely important. We have to be very transparent when we talk about COVID-19 vaccine. When I was getting my jab, I asked, about to get it, I asked my brother here, Dr. Faisal, I said, I react to things. Please bring EpiPen when you are coming to give me my jab. EpiPen is adrenaline that once you pass out, you can easily be brought back. And when they came to my office to give me the jab, I said, where is the EpiPen? And this is all, in the media. Why? Because I know my body, and it will not be because of the vaccine, it's because I react easily. And when they were about to give me, I said, where is the adrenaline? And they laughed. But even before I got it, I took Panadol like 2 hours before. As a mother, whenever I was taking my children for vaccination, I give them Panadol, just to be sure that if they have temperature, it will be. So it's the same thing as COVID-19 vaccine. So we have to be real about it. So I took Panadol 2 hours before, and also asked, where's the adrenaline? Thank God nothing happened to me. But why am I saying this? When you are developing a product, you have to make sure that you document the side effects. For COVID-19 vaccine, the benefits far outweigh the risks. For example, when they talk of blood clot and whatnot, you have one case in 1 million. That is statistically insignificant. To the person that had it, it is significant. Because without any side effect, there will never be any drug developed. So, the reason for collecting all these side effects is to make sure that we get everything right, dotted the I's and cross the T's. So sensitization is very important. We've been doing that using Med Safety app. It's a 5-minute video every week on NTA or TVC. We're going to go back now that we're getting the second rollout. So I want to assure Nigeria that anything that goes through NAFDAC and comes to primary health is safe for people. Does it mean that people will not have a few side effects here and there? They will. But I got mine and I'm smiling. Thank you very much. God bless.
Your Excellency, the Honorable Minister of Health, my colleagues, I say to the President, distinguished members of the press, good morning. I'll try to be as brief as possible because the Honorable Minister of Health has covered quite a large part of what we're doing around the deployment of vaccines. And my sister, Professor Ade, has also eloquently covered parts of the issues around how we're collaborating to make sure that we track and trace all vaccines to the sub-national level so that we are very clear about where our vaccines are and to ensure that once we finish the process of vaccination that we withdraw all the vials so that criminals will not get a hold of the vials and put in materials that may be harmful to our bodies. So we are very, very concerned about the news of fake vaccines occurring in other countries. Working together with NAFDAC and the Federal Ministry of Health, we want to assure Nigerians that we're doing everything by the books to make sure that doesn't happen. Let me once again express our profound appreciation to all Nigerians and indeed friends of Nigeria for the support that we received during the first phase of the strategic rollout of the vaccination. Later today, we're going to be receiving about 176,000 doses of the Johnson & Johnson vaccine that arrived yesterday. So today we'll do a sort of a formal review of the vaccines and then the cold chain equipment that are available to ensure that these vaccines maintain their potency. The principle of the Presidential Steering Committee and the Federal Ministry of Health, as guided by the Honorable Minister, is that these Johnson & Johnson vaccines are going to be prioritized for those who live in the hard-to-reach areas, the riverine areas, mountainous areas, itinerant workers, people who we have concerns that once they take the first dose, they may not be available for the second dose. And using GIS technology, we've been able to map practically all populations in Nigeria, and we know where these hard-to-reach populations are. They are the ones that we're going to be prioritizing to give the Johnson & Johnson vaccine. Now, in terms of the media reports around why we've delayed the rollout of the vaccine, Professor Ade has mentioned it, but I want to assure Nigerians that we're on track to flag off the next phase of the COVID-19 vaccine rollout next week, Monday. We're also expecting the AstraZeneca vaccine. Our plan is that for those who have gotten the first dose of the AstraZeneca vaccine during the first phase, there will be doses available to take their second shots in the next few weeks. Please make sure that you take the the AstraZeneca vaccine if that is what you took for the first dose. If you took first dose as AstraZeneca, please take the second dose as AstraZeneca. And if you're going to take Moderna as your first dose, also take it as your second dose. Do not be concerned that you may not get the second dose of the AstraZeneca. Please do not mix and match the vaccines. In this phase of the COVID-19 rollout, we've mentioned that we're going to use a whole of the family approach, bearing in mind that it is not COVID-19 alone that is our health challenge. In many of our communities, we have people that are struggling with paying bills for malaria, for pneumonia, for hypertension and diabetes. A lot of these conditions may go undiagnosed. Now that we're going into the communities with the COVID-19 vaccines, we're going to use the opportunity to also do screening for some of these non-communicable diseases, for malnutrition among our children. We're going to also provide routine immunization vaccines to our children so that we not only optimize the opportunity, but we save on costs and also send a very clear signal that the federal government, the state government from at every level cares about the health of Nigerians. We are also urging that people are clear that it is important to continue to use the non-pharmaceutical interventions, to apply them because the vaccines, from data that we have available, will protect you against severe form, hospitalization, and death from COVID-19. However, the evidence that we have right now does not conclusively show that it will protect people from mild disease. There are people who have taken vaccines, the COVID-19 vaccines, but still get mild disease. Perhaps those individuals will have suffered even more if they did not have the vaccines. So just because you have taken the vaccine doesn't mean that you can stop wearing the face mask. It is important to wear the face mask, but apart from that, not only are you protecting yourself, you're also protecting your loved ones and the community until we get to a stage where we achieve herd immunity. And the plan, as the Honorable Minister has said, is to ensure that we vaccinate up to 70% of the eligible population with the vaccines. Finally, I want to assure all Nigerians that now we have the vaccines, we have the cold chain equipment all across the country. We are now going to put our words into action. Thank you very much.
Questions now? Horatius, Choji, Son, and August is business day.
Good morning, Honorable Minister. I have
I would like to advise that before you speak, there is no need for you to remove your mask. We can hear you. So leave your mask on. You will notice that all of us who spoke left our masks on. Thank you.
Can I go on? Yeah, good morning, Honorable Minister. You just took off the say from my question. The question I want to ask first is ironic that when you vaccinate, you still wear mask. What encouragement are you giving to the society, or members of the society? It's better not to just vaccinate and wear mask and forget about the wahala of going to take vaccination. So I want to ask, what is the essence of vaccination when you still wear mask? Number one. Then number two, I heard the DG Center for Disease Control say that with what is happening, especially the new variant, now that there is a likelihood of some of those restrictions that were in place before coming back. Are we expecting lockdown, or what are we expecting? Then number 3, this has to do with the issue of the cholera outbreak. Before, in certain portion or section of the society, it is traditional for people to defecate in bushes and other things. There is nothing you can do about it. So I don't know how you are going to tackle such challenges. Because I was with a minister who is from a section of this country, and we're talking about the issue of open defecation. He just told me, look, there is little or nothing you can do about open defecation in certain section of the society. So what do you intend to do with this challenge? Thank you, sir.
Name and the media.
My name is Horatius Egwa. I am the publisher of thebridgenews.com.
Okay. Good morning, sir and ma. My name is Juliana Taiwo of the Sun newspaper. Honorable Minister, I'm surprised that the key issue, the people that will help you tackle this COVID-19 and cholera outbreak are on strike, and you did not mention it. The DG admitted that, DG NCDC admitted that 22 states are experiencing an outbreak of cholera right now. And the doctors are on strike, and I understand the consultants are threatening to join them on Monday. My question is, and you've been quoted, yourself and the Minister of Labor have been quoted as saying, threatening to sack them. My question is this the right thing to do? And for, let's say you succeed in sacking them, will you be ready should medical emergency occur? Will you be ready to subject yourself to the people that will take over from them? Then to the DG NAFDAC, I understand Brazil rejected Sputnik vaccine. Is Nigeria really comfortable with it? Thank you.
Follow-up question. Good morning.
Good morning, Honorable Minister. My name is Timothy Choji. I report for Voice of Nigeria. I would like to, first of all, know the percentage of Nigerians that have so far been vaccinated for COVID-19. And then based on that, you mentioned here that you hope to vaccinate at least 70% of the over 200 million population by next year. We're already in August 2021. Isn't that too ambitious? Is that achievable? Thank you.
Thank you very much. Honorable Minister, my name is Tony Aileman. I write for Business Day. My question goes to Dr. Faisal. Sir, we have a set of people who have already taken the AstraZeneca vaccine, and you rightly have told us that arrangements are afoot to give them the second jab. Now, I want to ask, do you envisage a situation where you're not able to secure these vaccines before the expiration of the period that the vaccine is supposed to last? And if such a situation occurs, what are you going to do for those who have already taken the first jab? Thank you. We shall respond according to the questions that were given. First, let me address the question of the mask. The purpose of the mask is to protect others, primarily. Those of you who have done the test for COVID, and I believe most of you have done it, know that when the sample is being taken, it's taken from your nose in the pharynx, and then another one through the mouth in the pharynx. What that means is that the virus resides largely inside the depth of the nose and in the pharynx. That's where it resides. Which means that if you have the virus, you might, if you don't have the resistance, you might get sick. Or if you have the resistance or somehow it doesn't manifest in you, you do not get sick, but you still have the virus. When a person like that sneezes or coughs, he emits aerosol droplets, tiny droplets, into the space. Some of them are so tiny that they are floating in the air for quite a while. So, which means that you can have the virus without being sick or showing signs of sickness, or you can have it and be very sick. In either case, you can infect others just by spraying it into the air. The same thing happens if you shout, or if you sing, or if you even heavily breathe out, because the virus is inside the respiratory system, you throw it into the air. Now, what does that mean? If all the windows here are locked and this room is full, the chances of people breathing in that droplet is high. And many people who have resistance, about 80%, may not show any sign, but people who are about 20% can get sick, theoretically, mathematically, can get very sick. Some of them can even lose their lives. Okay? So, if you have been vaccinated, what it means is that the vaccine will protect you because you have antibodies. But if you have the virus still infect you, you can still infect others. So getting vaccinated means that the virus will not harm me, but I can still get it. And if I, in a way, spread it around the room, the chances of getting other people getting it is very high. So I need to wear a mask despite being vaccinated, because I'm protecting others, not necessarily protecting myself. Even in your own home, you can have a vulnerable grandmother, or even the Delta case now, people who don't have vulnerabilities, they can easily, because you live in close quarters, you can easily infect each other. Now, if all the windows are open, and the doors are open, and you have more circulation of air, the chances are reduced that you can get, that other people can get that virus from you. If you are outdoors in the meeting, the chances are even more reduced that other people will get infected by you. So it's all a question of relationship. Again, if you have social distancing, somebody sprays the air by coughing or sneezing and has the infection, then the further a person is from you, the less likely you will get it. That's why we speak of social distancing. That's why I say no crowding. That's why I say have good ventilation. And avoid those places where you are forced to be close to people or where windows are locked. Houses of worship, market. But market are still okay because they are largely outside. And you have a lot of circulation that dilutes whatever it is that a person sprays out. Now, if you look at the Delta variant, which means that if this room were locked, one person had COVID and sprays it out, and it could, the variant we knew at first could infect 100 people. The Delta variant will infect 160 because it's more easily transmissible. It means even fewer droplets can get into you and make you sick. So those are the reasons why vaccination everywhere in the world. The US has vaccinated 61% of its population, but even their masks are still recommended. In some places, enforced. And in other countries where they have done even 70%, they tell you to wear your mask because protect everybody else. I hope that answers your question in that respect. Now, as for the lockdown is a very, very last measure that countries have taken. Because that lockdown stifles economic activity, it restricts your own freedom and your business. Both corporate business, both government business, both private business are all affected. So a lockdown is not something you do easily. And where you have to do, and of course, when we had that lockdown, we were all compelled to have that lockdown at the beginning. We learned a lot of lessons. You know, at that time, government provided palliatives to release the impact of it. If you couldn't go to market, if you couldn't do your business. But this is not what government is aiming to do. The government wants to do a lockdown. In countries where they have had serious threat, they have had to do what they call a precision lockdown. You know, in the UK, in fact, just Israel the other day announced that they are doing some lockdown. But there's no more generalized lockdown, but precision of certain areas. So many countries do what they call precision lockdown, so that it's not everybody that will be affected, only certain areas, to avoid too much damage to economy, to social life. And we are not at a level yet where we are feeling that threat to do any lockdown. But I tell you that many countries are not doing generalized lockdown, they're just doing precision lockdown. And as I speak to you now, there are several countries who are on one kind of lockdown or the other, at least, if my recollection is correct, at least 6 or 7 countries that are doing one form of lockdown or the other. We do not have that on the table right now. Now, the question of open defecation, that's a very good question because the cholera is a waterborne disease. And you will take it through contaminated water. If you drink raw water from the stream, and that raw water is carrying the cholera bacteria because somebody upstream has already defecated in water, downstream you think you are getting pure water. You're not. So people go freely and collect water. Now others, that's why we advise boil the water. The least you can do is boil the water that you are going to drink. Boil it. If you have a chemical to treat it, you can treat it. There is some chemical treatment. Now we are looking for that chemical treatment now to send to areas of concern. But even if you are not going to drink the raw water, if you go into the stream to swim or to take a bath, you might mistakenly take a gulp of the water. You might mistakenly. Also, when you have open defecation and it rains, parts of that fecal matter will be swept into the river. So even if somebody defecates in the water, the fecal matter can be swept there by stream, by the flood, or can be swept into a pool of water, into pools, puddles, after rainfall. I know that children go to puddles to go and play and practice swimming. And there, drops of these things can get into their mouth. So these are the areas where the Ministry of Water Resources has been emphasizing and the Ministry of Health has supported the abandonment of open defecation. Use a latrine. Latrines are not difficult to build, so that the risk of open defecation and sweeping of fecal matter into water that somebody is going to drink is reduced. So we are going to be having stronger collaboration. Ministry of Environment, the Ministry of Water Resources, and also Ministry of Women Affairs, because Women Affairs, women of the house, they control and oversee a lot of what goes on, what the children are doing, where they are swimming, where they are going. They can stop all these children swimming in puddles of water. So that's very important, and thank you for raising that point. Now, with the question of the strike, we have said openly that this is not a good time for doctors to go on strike. We're having a strike for the third time this year. That is not good. We have appealed to them. We have been having long meetings with the young doctors to tell them that, look, we have a certain responsibility to our country. Every country who has difficult situation at this time should understand that the responsibility is for all of us. If you have any problem, any grudges, let's talk about it. If we can't solve it now, let's continue talking until to find solution, but don't drop work. I think Nigeria is probably the only country in the world today where doctors are dropping work in the middle of a threat to the whole country. So that's why we have advised them. There have been no threat. Nobody threatened anything. It's just an appeal. All of us are doctors. All of us went through the same residency. We're saying this is not the time. Let's go on talking about it. Do not put people's lives at risk. That's what the Minister of Labor has been saying. That's what the Minister of Health has been saying. Nobody has threatened anybody with anything. Yeah, but that's a standard thing. That's International Labor Organization, ILO, recommendation that if you didn't work, then why will you take, your salary comes from taxpayers' money. So if you didn't work, why should you go and be saying you should be paid? Because if that is so, you can be encouraged to stay home for 6 months, and your salary is running from public funds, from taxpayers' money, and you have not given the community any service. So that no work, no pay is not just a government regulation. It's recommended, it's specifically stated in ILO regulations, International Labour Organization, that if you do not work, if you have not given any service, you can't expect remuneration, because you can't go to the market and buy something for nothing. You must put down something. You must put down work. You can't go to the market and take goods without paying. So if you work, you'll be paid. And we are strongly in support of government meeting its obligations to pay what is agreed. We have said that we shall push for that. You know, working with the Salaries and Wages Commission, the Accountant General's office, the head of service, we are working to support that, including paying all the insurance dues. But we cannot say, against what the ILO says, pay people who didn't go to work. I mean, I think before God and man, that you can defend that position. But there is no question of threat. These young doctors, they are, you know, they are professionally, not just professionally, they are young people who we need to also mentor and treat well to the best of all our capacity here. So the threat is not what, the strike is not what we want now. We would like to, again, use this platform to ask doctors to return to work. Let us negotiate. We can do that between, among us. We support, there are many areas we support them. The Ministry of Health supports them. But part of the problem we have is that some of the grudges that they have, or let us say the demands they have, are with state government. They're not with federal government. So if the state government has not paid some people's salary, why go on nationwide strike? We say, if you want to talk to that state, we shall even support you and appeal to the state. Among the 12 original demands that they made, 7 were state-related. They're not federal. Federal government, Ministry of Health can do that. We can't compel a state to pay you a certain salary that you want. But the ones that are concerning us at federal level, many of them are not even exactly the Ministry of Health either. But we support them in those ways. But strike is not a good tool to use, and especially when the health of the country is threatened. When people even come out and volunteer in other countries to work, that is not the time to withdraw your own service. And I think, again, we continue to appeal to young doctors not to use strike as a tool, especially at the time of national need. That will not rest well on your conscience. Then the question of the percentage of people vaccinated, I think the NPACDA will answer that. About vaccines rejected by Brazil, NAFDAC will answer that. how you can get your second dose in time. NAFDAC will answer that. And the question of, again, the lockdown, wearing a mask, NCDC can also contribute to that. Thank you. I'll hand over to immediately to my left, and then from there on.
Thank you, Honorable Minister. The question is about the Brazil rejecting Sputnik vaccine. Actually, Brazil rejected at the beginning. Brazil has taken Sputnik back, but they're at the same time doing clinical trials on it. But Sputnik is being used by over 70 countries in the world, and Sputnik V has gotten approval by WHO. Sputnik Light, that is a second type of vaccine, is yet to get approval. What we gave approval, what NAFDAC gave approval to is Sputnik V. And we started working with Gamaleya Research Institute that developed Sputnik since January. There are three mechanisms that we use to approve vaccine: reliance, recognition, and full review. We gave full review to Sputnik V vaccine. That is why it lasted 6 months, because we kept going back and forth, make them, provide this information and so on. So at the point when we approved, we had peace of mind. I had peace that yes, we can approve it. Like I said, there is no vaccine that doesn't have side effects. But we also gave Sputnik V approval a conditional approval, that the company will partner with us in the country to first of all do a small vaccination program and do a cohort event monitoring to ensure that the dose is fine. That is science, meaning we are not going to, come and give us 10 million doses at the same time. But this is just to ensure that the dose is going to be fine. But Sputnik V is it's a quality medicine, safe, efficacious. However, because of the backbone that it has, adenovirus 5 and 26, we want to be sure that those of our population that has been exposed to such before, that it is the same dose, that others that have not been exposed, that is the same dose that they will be given. So we approved it based on science. It is all science driven. Thank you very much.
No, just press it hard. Yeah, that's it. Yeah, thank you very much. The question from Mauritius has been answered by the Honorable Minister of Health in terms of the essence of the vaccination when you still have to wear a mask. So I'll respond to the question from Choji of the Voice of Nigeria. The total, the percentage of Nigerians that have been vaccinated so far is 2.3% of eligible Nigerians. And then I want to draw a demarcation, clarity between what you said, 70% of the population, and what we're targeting. We're targeting 70% of eligible Nigerians. Those are two different concepts, right? Because the only people who are eligible for the vaccine are those that are 18% and above. Those are the people that we're targeting, okay, with the vaccine. And what we have said from the beginning is that we plan to vaccinate this population, about 112 million Nigerians, within a span of 2 years, starting from when we rolled out the vaccine. And this is still dependent on the availability of vaccines, right? So if, for example, we'll go through a long stretch without vaccines, right? That means you cannot be vaccinating and you cannot count that as among the 2 years that we've provided. We've done the math, we've done the modeling, and we feel that we'll be able to vaccinate within a span of 2 years, okay? So it doesn't mean that we're going to end 2021, 2022, okay? Then Tony asked about, for those who have already gotten the AstraZeneca vaccine, how do we ensure? Are we sure that, we're going to get the second dose? And what will happen if we're able to secure the doses of the vaccines? We're in very close collaboration with our partners, and we take the science very seriously. For those who have gotten the first dose of the AstraZeneca, they will definitely get their second doses within the time frame that we've provided. Even as we speak, we expect that in the next few days, we will get additional doses of AstraZeneca. I think we have communicated this in the last couple of days. But even beyond these doses that we're getting in the next few days, we expect that before the end of August, we will be getting up to 3.9 million doses of AstraZeneca vaccine. So that is going to cover for the about 1.1 million Nigerians that we're expecting will get the second dose of the AstraZeneca. So we take this very, very seriously, and we're not concerned that we'll not have the vaccines to cover those that have already gotten their first shots. Thank you.
Thank you. Also, the Honorable Minister answered the two questions eloquently, but just to say that the COVID restrictions are different from a national lockdown. The COVID restrictions in the COVID regulations that was signed off by Mr. President have never been relaxed. Have never been relaxed. So please look at those restrictions and let us hold ourselves accountable to living within those restrictions. Those regulations, those restrictions that are contained in the COVID regulations that went through the processes signed off by Mr. President have never been relaxed, which is completely different from national lockdowns. Like the Honorable Minister said, that's an extreme measure. We hope never to get there, except it's absolutely necessary. But that's really not where we are at the moment. So I think we can manage if we implement just what is still in place, which regulates wearing masks, mass gatherings, all the things that we talk about every day. Thank you.
Honorable Minister, one of our viewers online asked a question, Onyeka Morin. She's asking, good day, please, is the vaccine safe for expectant mothers and women trying to get pregnant? Reuters, followed by MITV, followed by Leon, followed by Gloria, and Nation, and Farouk Liberty.
Honorable Minister, my name is Felix Ono. I write for Reuters. It's quite alarming that 22 states are having outbreak of cholera, and that the death toll within this few periods had been higher than what we have in COVID. I would like to know, since you've given us the death toll for COVID, I'd like you to also give us the death toll so far in cholera outbreak and concrete steps so far be taken, to stem the spread so far, because in view of the fact that you still have the doctors on strike, so who are the main people who are supposed to be treating the victims or those being affected? So I would like to know the death tolls and the concrete steps be taken. Thank you.
My name is Hassan Umar Farouk. I report for Liberty Radio and Television. There is this call from NMA to shut down NYC camps. And in this briefing, you assured Nigerians that the situation is being monitored. We'd like to know what is the true situation in those camps. Thank you very much, sir.
Good morning. I'm Gloria Omezuke from Channel TV. My question is to the Minister of Health. You mentioned earlier that the resident doctors obliterate the option of using strike as a tool. The other most logical option, which is negotiation, is not working. What are you actively doing to resolve this? Thank you.
Good morning, sirs. My name is Dr. Leon Usigbe of the Nigerian Tribune. The Honorable Minister, sir, I'm just wondering whether the federal government of Nigeria will consider providing self-test kits for COVID as it's been done elsewhere. Because to me, I think it has the advantage of speed and even reliability. And the second question I'd like to ask you, sir, is, sir, this one is so critical because it borders on discrimination against Nigerians. Okay, thank you, sir. Thank you very much. Sir, I do not know whether the government of Nigeria too has any relationship with other countries as far as vaccination is concerned. I'm asking this because it will appear that people that are vaccinated in Nigeria, fully vaccinated citizens, still suffer discrimination when they travel out, particularly in the UK. If you are a Nigerian fully vaccinated, and you are on board a flight with a Briton or anybody that is vaccinated in the UK, when you alight from the plane, why the UK vaccinated person is allowed to wander off, you as a Nigerian fully vaccinated, you are required to quarantine for 10 days. Why is it discrimination? Is government doing anything to address this? Thank you.
Morning, sir, Honorable Minister and DGs. I'm Bolaji Ogundele and I write for the Nation's paper. Dr. Ehekuazu, the last time you spoke about the number of people that have been affected by the Delta variant, you said 35. I would like to know how many we have now. We're saying about 80% of people, sequenced recently of that variant. Then, if we are looking at vaccinating about 102 million Nigerians, and so far, the vaccines that are coming have been gifted to us. And we know that we also have plans of buying our own. How soon will we start having the ones we are meant to buy? Thank you very much.
Good morning. My name is Folashade Abduslami from MITV. Honorable Minister, please we would like your explanation on this. The blame game between the federal government and the state government on the issues of the doctors on strike. The doctors insist that the federal government are responsible for the shortcoming and that they are also mute about their promises. What do you have to say about this? Then secondly, wow, it's very short. It's a follow-up, please. When do I go ahead? Okay, thank you. When will Nigeria be poised to get a homegrown vaccines for domestic diseases like cholera, Lassa fever, and others? Thank you.
Some of the questions will, of course, be taken by the heads of agencies here, such as you've heard all the explanation about pharmacovigilance and so on, and testing, whether it's safe for mothers and so on. Now, although the resident doctors have gone on strike, and as I said before, we are appealing to them not to use this very vulnerable period when the country is facing, you can call it a war. It's a wartime. When we are facing a dangerous virus variant. For those of you who have been very keenly following international news, you know the havoc that Delta variant did in India. I don't know how many of you are watching. And what it has done or is doing in Indonesia, Thailand, and other countries. That is a time, especially when you know that we haven't got the requisite vaccinated people's interest covered. We have only about, well, 1 or 2% of Nigerians, eligible Nigerians vaccinated. So we are really facing something like a war against microbe. When you face a war, that's not the time for soldiers to say they are not going to fight. So it's a moral question. I'm telling the young people that this is not the time. When everybody else is rising to defend their country, you say you are going on strike. Whatever it is, the reason, some of them just, some of them don't look so just, some of them easily can be solved, others are not easily solved. It's not the time to say we're going on strike. We are with you. We are also your professional colleagues. We've been through residency. We know where you stand. It's a national call for us to come up in arms. Let us work together, solve this problem, save lives. We don't want to see here what happened in India, where they lost over 400,000 lives due to COVID-19, Delta strain. We don't want that. So again, we are saying, using this opportunity, and I would like all of you to help to amplify that and say, no matter the problem, no matter the demand, we shall look into them, but let us work together to face this common enemy. You don't know who this common enemy is going to take. So all of us are humans. We don't know who. So all of us need to work together, put joint forces, and try to solve the threat to our country. But even then, during this strike, we have mobilized all consultants and youth corpers and all those who are render service to ensure that they are rendering service, to ensure that the hospital services do not collapse. And everybody is doing very well. I salute the consultants and youth corpers and all those who are not on strike, who are giving service, and also the private sector who are supporting us, because the private sector is coming up too, rising up to the challenge, to make sure that health services somehow or the other are going on, and there's no serious distress in the hospitals. But the earlier the doctors come back to work, the better it is for the whole country, the better it is for them. We shall say thank you, and we shall look into all the issues that you have raised. We shall support you in addressing the issues you have with individual states. But we cannot solve the problem you have with any state because there's division of power in the Constitution. The Constitution does not allow the federal government to dictate to state government conditions that, that the state government has put down. We can appeal. So again, let us join. And I invite you to join us and say, look, let's put this aside meanwhile and face the common enemy, which is the Delta variant that threatens us. Now, as for the NYSC camps, NCDC will take that part of it. And somebody has said that other tools are not working. What shall we do? Well, first of all, put down your strike. Lay down weapons. We don't need any tools at this time. All we need is tackle the bigger enemy, which can take lives. That's COVID-19. It can take lives if all of us don't pick up arms against it. So the other tools, we shall support you in your demands. If it is state, or if it is any of the organs that are responsible for payment of your allowances, whether it's Accountant General, as I've said, or wages, a lot of checks have been given out, compensation for life insurance for those who lost their lives, given out. A large number of them have been given out. So many of these things have already been met because they said that they were not paid for life insurance for those who lost their lives, which is quite clear. But that is being done to a large extent. So once there's response already coming to the questions you raised, and mind you, this slow response was coming from the insurance companies. So we'll be able to urge them to fast-track their own side of the agreement. And they have brought out checks which the Permanent Secretary Minister of Health has already delivered to the doctors. So government is trying its own side. But let us not bring out such tools at this time. That's my appeal for that again. As for the self-test kits, well, I will also allow Dr. Ewekwazu to answer that question. The vaccination acceptance, this is something that is just evolving. As you know, countries who have already done 60-70% of their own vaccination, fearing that anybody can bring their own vaccination and their own infection into their country, are beginning to talk about what they call the green pass, that will allow people to come in. Well, we have thought that it's not very fair because since vaccines became available, the distribution globally was not equitable. Some people had more and were able to vaccinate their citizens. Some countries hoarded so much vaccines that they could vaccinate their countries even 4 times over. In other countries who do not produce, we were left almost abandoned. We have done only 2%. So why, if you are now asking for pass, then that would be unfair to those who didn't get a chance, not through their own fault, but because the vaccine didn't reach them. So that's a discussion that is still going on. The African Union has waded in, and they called for a meeting, which we are going to attend. What are we going to do about those who are already vaccinated, now closing the door and saying, if you are not vaccinated, you can't enter my country? We have to address that issue. Now, the question of those who vaccinated Nigeria came from the fact that every country has tested and recognized certain vaccines. NAFDAC, for example, up till now has tested and given approval or rather authorization for 6 vaccines. Who applied? They applied to us. What had happened was that in some European countries, they were not using the Serum Institute of India made AstraZeneca vaccine that we used. And because we were not using that, they had not tested it, and it was not on their list of approved vaccines. Now, it doesn't mean that that vaccine is bad. It just means that they haven't tested, they haven't given the authorization for it. So anybody who took that vaccine, for them, was not acceptable, let's say. But that has been resolved. We have been told that now they recognize that version. It's the same AstraZeneca. But the point is that if it's made in South Korea or made in India, each one has to be individually authorized, even though they are the same vaccine. They had not tested or authorized the Indian type, but right now that problem is down. They have recognized that vaccine. But that's the only one we have used so far. We're only going to start using the Moderna within the next few days. And the African Union wants to have a whole of Africa, because this problem we are talking about now affects the whole of Africa, not only Nigeria. So we're going to discuss that and come up with a common African response to that new concept of issuing green pass to people. Now, question, how many Delta variants? Also NCDC. There was a question about buying vaccines, correct? Okay. What was the question again in detail? Yes, okay. Yes, Nigeria has bought vaccines. In fact, the ones who have been gifted are just a few million, 4 million here, 700,000 there, 100,000 there. Nigeria has bought 29 million, nearly 30 million, little bit short of 30 million, 29,850,000 Johnson & Johnson vaccine, the single shot vaccine. And at the time we bought it, it was $10 a shot. The price has dropped to $7.50. And we bought it from African Vaccine Acquisition Tax Team through the African Union. First deal, we take the whole of Africa approach. Now that the price has dropped, we are going to get even more than that, because the balance will be used to purchase even more, and we shall get nearly 40 million doses paid for by the Nigerian government, federal government. It's $7.50 per dose now. It was $10 when we first started, but the price came down, and then that means we get more than we had actually originally booked. So that will boost our vaccine stock, and that tells you clearly that the majority of vaccines going to be used in Nigeria is procured by government. It's not just a gift. Well, first of all, I will tell you that the transaction is not directly with the producer. It's going with the Afrexim Bank. Afrexim Bank pays for the vaccines, and all countries now deal with the Afrexim Bank, which is based in Cairo. That's the arrangement that has been made by AVAT. AVAT is an instrument that is serving the whole of Africa approach, since many of our usual friends and partners in Europe didn't come to our aid. The Africans got together to the African Union and formed a vaccine task team chaired by the president of South Africa, and taking care of the needs of African countries. Even those who cannot immediately mobilize the money will not be left, will not be abandoned. The Afrexim Bank will pay for the vaccines, and then you now pay with to the Afrexim Bank according to the arrangement you make. If you have cash to pay at once, you do that. If you don't have the cash, you have a payment plan. But you will not be abandoned. That is what they call the whole of Africa approach. This is new, and I think that's a very, very good thing to take care of ourselves. And it is the same AVAT team that is now pushing for vaccine manufacturing capability in Africa, for which Nigeria is also bidding to be a vaccine manufacturing center. When are you expecting the vaccine? The what? The manufacturing? The manufacturing is a process. It takes a long time. Apart from building the factory, you also have to get a license from those who are manufacturing, who transfer the technology. Some countries have said that they are willing to drop their intellectual property rights, because if somebody manufactured it, he has to give you the technology, and you cannot use it. You can't steal it and use, because you are breaking the patency law. But that's a process that's going on, and we have been promised support by Nigerians in good standing. We are having another meeting on Sunday to continue to prepare our case. And the government has, there's a company where the government has 49% interest, which we are going to, which we are supporting to be our candidate to produce the vaccine, not only for Nigeria, but for Africa. So that process is going very well to put us into that category. But this is a whole of Africa approach, which is very helpful for that. So that also answers the question of when the vaccines will be available. We can't say exactly when yet, because it depends on very many other factors, on negotiating intellectual property rights, the capital for it. We are hoping that some money will be appropriated and put down for it, for down payment, so that, but we have the manpower here. We have a company in which government has 49% with the private sector, so it meets all the conditions. And besides, Nigeria is the greatest market for such a vaccine. So we hope that we'll get that support, international support, to start producing, but the date of starting depends on factors that are beyond control for now. So I think that is all for my side. I'll allow the heads of agencies to do justice to the questions that were posed to them.
Just responding to the question about safety of vaccines for pregnant or expectant mothers. We go with the science. In Israel, US, a lot of pregnant women have been given the vaccines, and they have concluded that it is safe, or they are safe to use depending on the type of vaccine that you have. However, that would be between the pregnant mother, woman, and their doctor. Their doctor must advise them, but from all that we can see from literature or from publications, scientific publications, pregnant women in the US especially have been given a very significant number, and they have not reported any undue serious side effects. In fact, that's encouraged Pfizer to step down the age for their own vaccine to 12. So now they are getting, vaccinating, 12-year-old and above, and they're going to even step it further down to 6 months because they've seen that for pregnant women, their babies, as far as we know, had no side effects. So that would be the only response that I can give. Thank you.
Particular question about when we're going to start receiving the J&J vaccine that was procured by the government of Nigeria. Earlier in my address, I was specific in saying that we got about 176,000 doses of the J&J vaccine yesterday. So that is part of the 29,850,000 doses that the federal government procured. So we have started receiving the vaccines. We will get additional doses of the J&J vaccine before the end of the month. And the plan is to continue to bring this in batches until the 29,850,000 doses is fulfilled. Thank you.
Thank you. So 4 quick answers. First one is on cholera. This year we've had 31,000 cases and 816 deaths from cholera. So we have to put that into perspective. This is a disease that should have been history in our country many years ago. So that's the current challenge that we face. The second question was on the NYSC camps. I really haven't seen or heard what NMA said, so I can't really comment to that. But I must say that the NYSC exercise must really be celebrated as a national success story. This is an important program for the country that is time-bound. So if you stop, imagine you stop camp for 6 months. People are graduating, so people will start accumulating, and we have a backlog. So from last year, we worked out a plan with the DG of NYSC, spread out the period of the camp more, reduce the numbers in every camp, so a lot of investments go into this. Came up with a program to test every single person going into youth service, provided every camp with the IPC materials they needed, trained champions for infection control among couples. So I think this is a fantastic intervention by several federal government and state partners, because the state governments have been involved in every state where this has been carried out, which has enabled, despite this pandemic, for us to continue carrying out this important program for the country. NYSC is, imagine an education system in the country without youth corpus. You know, a lot of teachers at the state level, a lot of primary healthcare centers depend on corpus, and they also learn. So once you stop this program, there are consequences that are way beyond what is normally understandable to be the consequence. So we have to really encourage the collaborators that have made this possible for us to continue. Yes, there will always be a few bottlenecks here and there, but we mustn't stop this important program for the country. The third question was on self-test kits. You know, I think we have to be realistic in terms of what we compare ourselves to. There's no country in Africa or in Southeast Asia that is using self-test kits at the moment, because the kits are not the problem. It depends on an educated population. To do that test yourself, you need to really understand, read directions in detail, do the test, take it to the post office, post it. It will be received in a lab. They do the test, post it back to you. So there are several factors that are required to make a system like this work that we are still in the process of developing. We are not yet fully there. So we have to do what we are able to do. What we have, however, done is make sure that we are now taking the RDT testing kits to all levels of the health sector, including primary health care. So we're working with our colleagues at MPHCDA and all the other programs delivering health care at the primary health care level, wherever there's competence to do whatever test, whether it's pregnancy test, HIV test, it's a similar process to do the RDT. So we're taking it down to the lowest level of healthcare provision in the country to make it more accessible. The final question for me was on sequencing. So remember, we're not sequencing all viruses, all positives, right? We cannot do that. It's a very complex process. So we always take a number of them and sequence. So far, we've done 76. We found 76 Delta variants out of those sequenced, but the most important indicator to count is what I mentioned. 80% of those sequenced recently in the last 3 weeks are the Delta variant, which is a fairly representative sample to most cases in the country apart from Lagos. We are not yet sequencing enough from Lagos. We're working with them very closely to get more positives to sequence, but at least we're fairly confident that what is driving the increase in cases in Nigeria right now is partly the non-adherence to the public health measures, but secondly, the emergence of the Delta variant as the dominant variant in Nigeria, which is the same as what is happening in many other countries in the world. Thank you.
At this point, my duty is to appreciate everyone here, and I'd like to start from our colleagues in the media, members of the State House Press Corps. If this had been arranged and you didn't come, it will have been all futile. We want to thank you for coming. Thank you for your cooperation in the past 17 weeks. This is the 18th edition of the briefing, and you have disseminated the information well. On this issue of vaccination for COVID-19, information is very important. Public enlightenment is very important. I met somebody early in the week and I asked whether he had been vaccinated. He said no. I said, why not? He said he learned that everybody vaccinated will die within 2 years. So with that kind of disinformation, misinformation out there, there will be vaccination resistance. So the media has a lot of work to do. Please continue to do your level best so that things can improve vis-a-vis vaccination in the country. I want to thank members of the Presidential Communication Team who planned this, who put it together, who had been live streaming. Since we started here over 2 hours ago, they had been streaming this live, and millions of people have had the opportunity to follow us. Thank you, all members of PCT. I also want to thank what I call our faculty, a formidable one, very, very formidable one. The facts have been deep and enriching. I want to thank the DG NCDC. I want to thank the CEO of that one, MPHDCA, is that it? That is a mouthful. Dr. Faisal Shoaib is our friend. Thank you for coming. And DG NAFDAC, Professor Muji Adeyeye. Thank you. Our minister, this is the third outing since we began this enlightenment process for the country on what government is doing. We thank you that each time we've invited you, you did not hesitate to come. Thank you for today again. It has been deep. The information value has been very, very high, and I believe the media people have a lot to chew and a lot to give to the reading, viewing, and listening public. We thank you very much. Welcome, sir.